Hello, my name is Chris Idarola. I am a student at the Doctor of Physical Therapy program at the University of Central Florida. This is my patient Kyle Perkins, and he's coming to see me with a diagnosis of right Achilles tendonitis. So what we're going to be doing is a soft tissue mobilization, or a massage if you will. We're going to use a transverse friction massage on his right Achilles, and the purpose of this modality is to kickstart the inflammatory process, apply a little bit of low-grade tissue trauma, so that way over time, his tendinopathy can heal, and hopefully he can get back on the right track and back to activity. The first thing I want to do is ask you just some general precautions and contraindications just to make sure that you're good to go with treatment. We're doing it on your Achilles, so generally we don't have a ton to worry about, but I'm just going to ask you them just to be safe, okay? Mm-hmm. Do you have any history of heart disease, vascular conditions, not limited to arteriosclerosis, thrombosis, embolism, acute phlebitis?
No.
Do you have any presence of varicose veins, any skin infections, any cellulitis? Mm-hmm. Good. Do you have any presence of synovitis, any abscesses going on anywhere that I should know about? Mm-hmm. Do you have any history of cancer in the past 5 years?
No.
Okay, I can see you're not pregnant. And finally, do you have any other acute inflammatory conditions in the heel, in the foot, or in the...
No.
Nothing? Okay, so we should be good to go with treatment. The first thing that we want to consider is patient positioning. We're going to put him in the prone position. We're going to do this for approximately 7 to 10 minutes. We want to do this daily over a long period of time, so that way we can get the chance for the inflammatory process to get going. And we want to also consider draping. So what I'm going to have you do is, can I have you get on your belly onto this image? And then we're going to take some sheets here, and we're going to drape him. Still exposing his right Achilles. Okay? And we're good to go. Good. Okay, so after properly positioning our patient, we are going to then palpate the Achilles tendon, make sure we're in the right area. In a transverse friction massage, we're going to want to go perpendicular to the muscle fibers, apply a pretty decent amount of pressure, and use no loop because this is a friction technique. We want to initiate just a slight amount of tissue damage so that way we can kickstart the inflammatory process and make sure that we can get this tendinopathy healed. Now, I'm just going to warn you again that pain during this treatment is going to be normal. So I'm going to go along the Achilles insertion onto the calcaneus. I'm going to ask him for his point of tenderness right there. Okay, so I'm going to primarily focus on this area, and then from there I'm going to apply my pressure. And you can either do this with 2 fingers. I like to use the thumb on one side and then another. So I can go on this side over here and use my thumb. And then I can go on this side, making sure my thumb's not hyperextended or anything. And applying that friction there. And you can also use 2 fingers, just making sure that it's deep and you're applying just the right amount of pressure. Okay? And again, pain is normal. We're going to perform this around 7 to 10 minutes, and we're going to do this daily so that way we can make sure that the inflammatory process is back on track. Once this procedure is done, I'm going to ask the patient how he felt. How did you feel, patient?
It hurt during, but it was good after.
Okay, good. And that's normal. As long as we can do this daily and you can perform this in any tendinopathy, we can hopefully truly get the positive effects of transverse friction massage. That concludes this video.